Hello, everyone. I'm Colin Murphy. I'm with the Dassault Systems Benefits team, and joining me today is Maureen Giggy. I'm located in the Charlotte, North Carolina office, and Maureen is my manager, and she is located in Waltham, Massachusetts. We are thrilled, really, to meet with you today to go over the benefits that we do offer here at Dassault Systems. And I encourage you to have, if you do have questions throughout our presentation, feel free to ask at any time. I know it's via Skype, so it's not the easiest to stop or interject, but please feel free to do so. We'll take, we'll say, about an hour and 15 minutes to get through the presentation, I think, and then there'll be time, again, throughout the presentation, but also at the end for any questions that you may have. Our focus today, obviously, is on the Dassault Systems benefits plan and the CST population moving onto that benefits plan as of January 1st. We'll go through really the eligibility for benefits. We'll walk through each of our different benefits that we offer, including the healthcare benefits, income protection, paid time off and retirement, as well as the additional benefits or voluntary benefits that we offer. We'll also give you a little preview of how you'll do that enrollment. It'll be an online enrollment tool as well as access to making your enrollments over the phone, as well as the tools and tricks that we have available to help you make the right decisions for you and your family. There'll also be a portion on a transition for payroll, as well as some other items here with really transitioning to Dassault Systems as an organization. To start with, though, focusing on our benefits, I want to give you a little highlight of what Dassault Systems considers its foundation or its pillars when it comes to benefits. We want to provide competitive benefits that are valued by employees, they're sustainable for the company, and they do provide a culture of health. From a competitive benefit standpoint, what we're really talking about here is we are benchmarking our benefits against both national industry averages, but also specifically in the high-tech industry. We want to provide benefits that are competitive, that are valued by employees. We do reach out to our employees and get feedback throughout the year, and the employees undoubtedly provide feedback to us of what works and what doesn't work, or what they'd like to see added to our benefits, etc. And we take that into consideration and do make adjustments to our benefits on an annual basis. In terms of sustainability, Dassault Systems has, for its medical, dental, and vision insurance, are covered by what's called self-insured or self-covered benefits. What that means is every time that you or a family member incurs claims, Dassault Systems is paying its portion and you're paying your portion. The insurance providers that we're working with, Blue Cross or Delta Dental, VSP, etc., they're actually administering the claims, meaning they're experts in processing claims, but the actual payment of those is through Dassault Systems. So we focus really on that fourth pillar, that culture of health, to make sure that we can provide these benefits in the long run. From a culture of health perspective, we're focused on really overall wellness for our employees. You'll see throughout the year presentations on various aspects of wellness, whether it's truly a health component or wealth, your personal life, etc. We have a series of education opportunities to promote that. But in addition to that, really within our benefits program itself, there are tools available to try and help you and your family members remain healthy. Some examples of that would be with our fitness fitness reimbursement program or our weight loss reimbursement program, both tied to our medical program. You have the opportunity to get reimbursed for those activities. We have an actual wellness program that we'll talk about later in this presentation that focuses on rewarding you for healthy activities, whether that's through physical activity, taking nutrition courses, learning more about different wellness activities that can make you and your family better. And then finally, built into our medical, dental, and vision plans, preventive care treatment. Each of those, in each our medical, dental, and vision programs, you won't pay anything for preventive care. So whether you're going in for an annual physical or getting a wellness screening, examples like prostate exam or a mammogram, etc., you don't pay anything for those services. Similarly, on our dental and vision plans, going in for a semi-annual checkup on the dental plan, there's no cost to you, and similarly on the vision, getting your annual eye exam, there's no cost to that. We're focused really on that preventive aspect because when you're going in and getting those annual screenings, you're identifying, you have the potential to identify any issues sooner, which is going to provide you with better access to treating any of those between you and your physician. In terms of eligibility for our benefits, all of our employees that are regular employees working at least 20 hours per week are eligible for our benefits, as well as your spouse or domestic partner. Domestic partner can be same-sex or opposite sex, and any children that you have up to the age of 26. The last note on this slide regarding eligibility is if you are enrolling a domestic partner in your benefits, you'll complete your enrollment just like anybody else. You'll list your domestic partner, but our DS Benefits Center will automatically send you a domestic partner affidavit that both you and your partner would be signing. That basically is just confirming that you are in a committed relationship and that you've been living together, etc. So that's the basics of our eligibility. In terms of enrolling, here at Dassault Systems, again, you're going to be transitioning from the CST benefits that you've been on onto the 3DS benefits program effective January 1st. We have an open enrollment period coming up. It's going to take place October 30th through November 10th. That's going to be your time to make those benefit elections for 2018. If during the course of 2018 there's something that's happened in your life, whether it's you've gotten married or you've gotten divorced, if you had a baby or adopted a child, etc., those are all known as qualifying events. That allows you to make changes to your benefits mid-year. If you don't have a qualifying event, it's that annual enrollment period that you'll have that opportunity to make changes to your benefits. So what you're electing here in October, in the late October, early November timeframe, these are going to be the benefits you're going to have throughout the 2018 calendar year. And then again, every year we'll have that same opportunity for you to make changes to your benefits as you see fit. We'll start walking through each of the different medical plans that we do offer, and we'll start with our medical plan. Here at Dassault Systems, we do offer 3 different medical plans, the copay plan, the coinsurance, and the health investment plan. Basically, what these 3 plans are offering you is helping you with 3 different choices in terms of how you want to pay for your medical coverage. The copay plan is really designed to, you pay more at time of service and then you pay very little, or I'm sorry, you pay more per pay period and then at time of service you pay very little. The health investment plan is sort of the flip side of that. You're paying more, or you're paying very little at paycheck, but at time of service you may pay more. The coinsurance plan has some features of both, but again, you're paying a lesser amount out of your paycheck. Within Dassault Systems, all 3 of our plans are through Blue Cross of Massachusetts, and there are many similarities in them, and then again, those key differences, that'll be what you're making your decisions based on. In terms of the plan similarities, again, every service that's covered under one plan is covered on all 3. So if you're looking for which plan offers chiropractic care, the reality is if it's covered on one, it's covered on all 3. The difference is how you're paying for it. The network of doctors, again, all of our plans are what are known as PPO plans, our preferred provider program. And basically what that means is there's a network of providers. You don't have to pick a specific doctor, but as long as you're going to an in-network Blue Cross provider, you're getting a preferred rate for those services. So again, that network of providers within the Blue Cross system is exactly the same on all 3 plans. We do encourage you to take a look at the Blue Cross network and identify if A, your doctors are already in the network, or B, if you need to consider moving to an in-network provider. I know you did have Blue Cross before, so I do expect that there shouldn't be much, if any, transition from a provider experience for you. But we do, again, encourage you to take a look at that. Again, all of our plans are national plans, or we've designed them in essence, so regardless of where you are in the country, you have the same level of coverage, you have the same access to physicians. So if you are living in Massachusetts and you have a child going to school in California or vice versa, your child is still going to have that access to that same coverage regardless of where they're living. There are providers throughout the U.S. and anybody on your plan would have access to any of those providers. We talked before about the preventive screenings. Again, those are covered at 100% regardless of which plan you're signed up for. We have a telehealth service, so telehealth is becoming more and more an opportunity for people. So again, if you have an ear infection or a sore throat, etc., you don't necessarily want to take the time or maybe it's after hours, you can take advantage of telehealth have an appointment right over your computer, right off over your smartphone, right over your tablet, in order to receive care, get that prescription that you need for, we'll say, the more minor treatment issues. It's also a great opportunity for anybody if you're in need of mental health or behavioral health services. You can have appointments over your phone from your own home. So telehealth is becoming a new area of healthcare that people have begun taking advantage of. Our employees are starting to take advantage of it. We've had this program in place for about a year, and we're seeing those numbers tick up in terms of the number of people that are taking advantage of that service. And it's not only more affordable for you, but also obviously more convenient when you don't have to leave your own home. I mentioned also before the fitness reimbursement and the weight loss program, just an opportunity, again, to encourage you and for you to take advantage of services and get rewarded for that. So again, reimbursing yourself for any type of gym membership that you have. That includes whether it's going to the YMCA or a Gold's Gym, or maybe you take classes like a Zumba or yoga or Pilates. You can get reimbursed for those classes up to $150 per year per household. Similarly, weight loss program, if you are a family member are participating in either a Weight Watchers program or a doctor prescribed weight loss program, you can get reimbursed an additional $150 for that. So again, all three of our plans are providing you access to those services. So you're not choosing your plans based on that. You're really choosing these plans based on the second column, the plan differences. And that is, again, the cost for coverage. So again, the amount you're paying out of your paycheck, and we'll look at that on the next screen. The cost for care. So this would be what type of services do you expect to incur during the course of the year, and what would you pay for those? And then finally, the access to a tax-free savings account. I think you all are familiar currently with flex spending accounts, the healthcare flex spending account that you have in place with CST today. That would apply to anybody that's enrolling in our copay or the co-insurance plan, whereas the health investment plan has access to what's called a health savings account. And we'll spend a little bit more time on that because the health savings account is sort of like a supercharged flex spending account. It provides much more flexibility, and there are some key advantages to participating in the health savings account. In terms of rates, this is really the first time that you're seeing the differences, I suppose, between within CST. You have been paid on a monthly basis, whereas starting in January, you'll be paid on a bi-weekly basis for 26 times per year. So clearly, what the rates you were used to seeing from a CST side on a monthly basis far exceeded what we've got here at Dassault Systems, but do keep in mind that it is a bi-weekly deduction that we're talking about at this point compared to what you were paying at CST. But again, these would be the deductions that you would pay from your paycheck for any of these. So again, if your family plan signed up on a copay plan, you would be paying $214 per pay period on the copay plan versus say $90 on either the co-insurance or the health investment plan. Again, those are coming out of your paycheck on a bi-weekly basis. Starting to get into a little bit more of trying to help you figure out which plan is right for you. We'll start, I suppose, with the copay plan. This plan really is designed, I suppose, to be the simplest and easy to understand plan for a participant. Again, with this plan, you are paying more per pay period for this plan, but at time of service, you'll see that there is no deductible on this plan. And basically what you're doing is paying copays. So if you go to see a primary care physician or a specialist, you're going to pay either $25 or $35. If you go to the emergency room, you're paying $100. MRIs and CAT scans, you pay $30. And then the telehealth services, you're paying $15. Copays are all you're ever going to pay on the copay plan, presuming that you're going to an in-network provider. So if you get a bill that seems different than one of these copays, either you've been billed incorrectly or you've gone out of network. It's really designed to be a simple and easy to understand plan. Sort of the flip side of that is our health investment plan. The health investment plan is what's known as a high deductible plan, and you can see the deductibles here, $1,350 or $2,700 for family. This plan is, I think, probably the most different from what you're used to at CST. Our health investment plan, like I said, is a high deductible plan, and what that means is you have the responsibility of paying for every one of your medical or prescription expenses until you reach that deductible, that $1,350 or the $2,700. And you'll also see that there's employee-only coverage or family coverage. Again, you'll be able to elect employee plus spouse or employee plus children or family coverage, but in either case, whether it's employee plus spouse, employee plus children, or family, you fall into the category of family coverage when it comes to deductible. So once you've reached your deductible on the health investment plan, then you're covered at 90% and you're paying 10% of the cost for those things like primary care visits or ER, etc. So it's really putting more of the onus on you, the employee, to cover that deductible period. But after you've reached that, you have that 90% coverage by the company. You're probably saying, "Wow, why would I choose that?" And really, what that comes down to is that health savings account. You have access to the health savings account. Not only do you have access to it, and we'll talk more about what that health savings account is, but also the company is making a contribution into that on your behalf. So if you are signing up for individual coverage, you're getting $750 added to your account by the company, or $1,500 if you're signing up for any family coverage, whether that's, again, employee plus spouse, employee plus children, or that family coverage. So again, on the health investment plan, it's probably not as simple or easy in terms of usage as that copay plan, because again, every bill that comes through, you're going to be managing those costs. You're going to be paying bills. You're going to see bills that are undoubtedly higher than what you're used to. You're used to seeing copays for office visits, etc. The health investment plan does have sort of that shock value, especially for a new participant of, hey, I'm not used to paying $150 for that office visit when I'm still in my deductible. But again, there are some key advantages to this, and we'll talk about those in a little bit. Sort of the plan that has some features of both is that co-insurance plan. It's sort of in the middle. You can see that it does have a deductible. It's much lower than the high investment or the health investment plan, but obviously it's higher than what's in the copay plan. So you're paying $250 or $750 deductible with the co-insurance plan. But the co-insurance plan does have features similar to the copay plan, like the office visit. If you're going to an office for a primary care or a specialist visit, you have a copay, or the emergency room, you have a copay. So it's giving you some of that comfort of knowing those standard things that I'm going in for, I just have to pay a copay for. Other things, you're covered at 90% and you'd be paying 10% after you've had that deductible. So whether that's outpatient surgery or an inpatient hospital stay, you would have that $250 deductible per person. Once you've reached that deductible, if you're covered at 90%, you'd be responsible for 10%. The other key thing I do want to point out is the out-of-pocket maximum. Again, this isn't new, and your plans have these as well. But this is sort of that cap or that worst case scenario for you of what you would ever have to pay out of pocket during a calendar year. So each plan does have that out-of-pocket maximum, and that is preventing you or making sure that you're aware of what your worst-case scenario is if you reached all of your expenses during the course of the year, what your out-of-pocket expense would be during the course of a calendar year. Now, when you are signing up for a medical plan, you'd automatically be enrolled with prescription coverage as well. But in Dassault Systems' case, we do work with another provider. It's called Express Scripts. So you will receive a Blue Cross ID card, and that's what you go whenever you go to the doctor's office or the emergency room. You'll show them a Blue Cross ID card, but you're also going to receive an Express Scripts card, and that's what you'd use for any type of prescription drug need. So if you're going to the local pharmacy or you're using or getting mail order prescriptions, that Express Scripts ID card is what's giving you that benefit or the information that those providers would need in order to bill you correctly. With our prescription program, you can see there's 3 tiers for your prescriptions, whether that's retail or mail order, the generic, the brand name, and the non-preferred brand name. And basically, you can see you're paying $10, $25, or $50 on the copay or the co-insurance, or for mail order, you're paying $20, $50, or $100, or you're paying 3 months, or you're paying for 2 months and getting 3 months of prescriptions via the mail order program. I do want to point out here, and we'll talk about it a bit more on the next slide, our program does push you to take generic medications. It's a cost savings for you. It's a cost savings for the company as well. Generics do cover you. They're the same ingredients, the same treatment as a name brand drug. So you are encouraged and expected to use generics when available for your medications. So if there is a generic available and you choose, or your doctor is recommending that you're using the brand name drug, you would have an additional cost for that. You'd basically be paying the co-payment plus the difference in cost between the generic and that brand name drug. The health investment plan is different. Again, there's no copays on the health investment plan. You're paying the full cost of that medication until you've reached that annual deductible for your medical plan. Once you've reached the annual deductible, then you would be paying 10% of the cost of those prescriptions. The only exception to that is for preventive medications. There are copays for those, and again, those preventive medications for things like diabetes or perhaps a heart condition, there are copays for those specifically, and the reason for that is they don't want, we don't want price to be an inhibitor for you taking a medication that is, in essence, needed for your continued health. So you do have access for that. There's a list of those types of medications available on our benefits website. You can see, or you can obviously contact Express Scripts as well to identify if you are on any type of maintenance medication that would be covered at a copay rate rather than at the full cost through that deductible. There are a few things that we want you to be aware of, specifically with prescriptions as you're transitioning from the CST plan to the DS plan. And the first is, if you or a family member do take any type of maintenance medication, we strongly recommend that before January 1st, you do get a refill, whether that's through the retail pharmacy or through the mail order program that may be available with CST. Go ahead and get that so that you're not in need of getting a prescription on January 2nd or January 3rd. We fully expect that everything will be in place for January 1st, but there's no harm and there's no negative from getting that refill prior to January 1st through the CST program, so that you're not scrambling January 1st or 2nd trying to get a refill of some needed medication. The other thing is that Dassault Systems has a number of programs put in place that we want to make sure that you're aware of. And basically all of these programs are designed for, first and foremost, your best care. But secondly, they are cost containment measures that we think make sense in terms of running a program properly. The step therapy program you may have heard of, where in essence there are lower cost medications that for some types of treatment they recommend that you work your way up to the more expensive based on trying to identify what medication would work best. So they will start with we'll say lower cost medications that treat the same type of illness or disease, and then they'll work their way up to identify which programs work best for you. Prior authorization is really just around, there are some medications that your doctor may prescribe, but they have to verify with Express Scripts, here's what that medication is being used for and why we're prescribing it. Again, making sure that medications are being used for the right treatment. The generic drug program we talked about slightly before, this is really designed about strongly encouraging employees to take advantage of the generic medications when available. Generic medications have been proven to treat, to have the same ingredients as perhaps a brand name medication and are doing the same treatment, and it costs significantly less for both you and for the company. So that program is in place for that. And then finally, the mail order program. We do not require anybody to use the mail order program, but there are certainly benefits to doing so. The mail order program, as we mentioned before, you're getting 3 months of prescriptions for the price of 2 months. Now, you may find that that seems like perhaps you're not interested in getting that set up, or you have a relationship with your local pharmacy. You're welcome to continue that. But please note that you do have to make an active selection that you will want to stay with the local pharmacy. You're able to get 2 refills at the local pharmacy. By the time that you go in for that 3rd refill, you have to make that active selection as to whether or not you want to switch to the mail order program or stay with the local pharmacy. If you do decide to switch to the mail order program, Express Scripts makes it very simple and easy. They can take all of your information over the phone. You can do it online as well through the Express Scripts system, or you can say, you know what, no, I'm happy with the local pharmacy. I'm good with paying that copay every month rather than the savings potential through the mail order program. That's your right, but you do have to make that active selection. So just keep that in mind if your family member is on any type of maintenance medication. Flex spending accounts, these are benefits that you're familiar with today. CST has these as well. Healthcare FSA, it's an opportunity for you to save on any type of medical, dental, vision, or prescription drug expenses that you're incurring out of pocket. This would be specifically for our employees that are enrolled in the copay or the co-insurance plan, or perhaps you're not getting your medical insurance through DSO systems. You can sign up for that healthcare FSA. We expect the limit for 2018 to be $2,650, so we've listed this here. The IRS usually comes out with their new limit right around October 31st. So that would be how much you can put away into your healthcare FSA. With our FSA, and probably similar to yours, there is a debit card that you'll receive. You can use that at point of purchase for any type of expenses that you're incurring. Again, any type of out-of-pocket medical, dental, vision, or prescription drug expenses or eligible expenses that you incur. Or you can pay out of your own pocket, get points on your own credit card, etc., and then submit for reimbursement through WageWorks, our FSA provider. So you have both options in terms of how you want to pay for your expenses. For any of our employees, we do have a dependent care FSA. So if you've got a child, typically I would say a child in daycare or you can put away up to $5,000 into a dependent care FSA account. Now again, with flex spending accounts, these are what are known as use it or lose it programs. So again, you do want to make sure that you incur your expenses. The program is going to be running for you, again, calendar year 2018, so from January 1st through December 31st. You do want to make sure that you're incurring those expenses during that calendar year and submitting for reimbursement, in our case, by March 31st of the following year. With CST, we do know that you currently have a rollover provision. So if you have funds left over in 2017 that you didn't claim, up to $500 of those could roll over into 2018. First and foremost, we are recognizing that and we're honoring that and making sure that any funds that you do have that would roll over from 2017 into 2018 will be added to your account within WageWorks, within the DSO Systems plan. That said, I do want to make clear that DSO Systems does not also have a rollover provision. So the funds from 2017 into 2018 would be the last year that rollover provision exists. So when you're making your elections for 2018, please keep in mind that you don't have that flexibility to, in essence, over-contribute and then have funds roll over. So you really do want to make sure that you're contributing what would make sense or what you know you'll get reimbursed for during the 2018 plan year, taking into account any amount that you may have rollover from 2017. In terms of when those funds from your current provider, I think it's Choice Strategies, will roll over. We're still finalizing the information on that, but again, you'll have that opportunity to have any of those funds up to $500 added to your 2018 account once 2017 claims have finished processing with Choice Strategies. If you are enrolled, if you're deciding for 2018 to enroll in our health investment plan, please note that you can't have both a flex spending account as well as a health savings account at the same time. Again, DSO Systems makes that contribution to your health savings account, so all of our employees that are enrolling in the health investment plan automatically would have an HSA. So for any of you that have an FSA that you were hoping to roll over into 2018, but we're going to be enrolling in the health investment plan, just please note that you don't have that option of having those funds roll over. So that's the last bullet point is, I suppose, the most important thing, or what we would strongly encourage. Please use up your FSA funds before the end of the year. Perhaps if nobody had any, then this really won't be a topic or an issue for any of us during the course of 2018 in terms of rolling that over. But again, it's your account, it's your funds, and we want to make sure that we're honoring that. But please make sure, if you can, try and use up whatever you've elected for 2017 by the end of this calendar year. The health savings account is what we were talking about previously when we were talking about the health investment plan. The health savings account really is sort of that supercharged FSA account, healthcare FSA account. What's special or unique about the health savings account compared to the flex spending account is you're able to have that money go into your deduct from your paycheck pre-tax, just like the FSA. The money goes into a health savings account, and there's two pieces here. One is you can just have it invested in, or I'm sorry, just leave it in basically a bank account. It is actually earning some interest for you, whereas with the flex spending account, what you put in is the amount that you're able to get back. The health savings account does have interest. It's an interest-bearing account in your name. You own the account all the time from the time the first money goes in, whether that's DS contributions or your own contributions. You own all of that money. You also have the opportunity to invest this money. So it's very similar from that aspect to a 401k plan. You're able to put money into the health savings account, invest it like you do with your 401k. So there are different types of mutual funds to invest in. And at the end of every calendar year, there is no use it or lose it aspect. Whatever you don't reimburse yourself in 2018 will just roll over into 2019 and beyond. So these funds can really build up over time. Fidelity has an interesting piece of information, or their calculations of what the average couple will spend on healthcare costs in retirement, so from age 65 through the end of life. And at this point, a person that retires now at age 65, they're expecting that couple would spend about $265,000 in healthcare expense. So again, you could obviously pay for those expenses with your 401k account or whatever retirement savings you may have, but you've paid taxes on that at some point, either when you put the money in or when you're pulling those funds out. With the health savings account, you're never paying taxes as long as you're using it for healthcare expenses. So again, if you put money in 2018 and you've got expenses in 2018, fantastic. You can reimburse yourself in 2018 for those if you want to. Or you can leave those funds in, pay out of your own pocket for those expenses, and at any point in the future, you can reimburse yourself for those expenses, whether it's in 2019 or sometime when you're retired, you can reimburse yourself for those expenses. So it's really giving you that flexibility of using those funds as you want. I know some people are thinking about using their health savings account sort of like a college savings fund. They've got young kids now. They plan to pay for all their expenses out of their own pocket at this point. They're filling up their health savings account here year by year. They've incurred claims, but they've paid those claims out of their own pocket. But at any point in the future, they can reimburse themselves from that account. So the funds are sitting in investments. They're growing. They've got, say, $8,000 worth of claims that they could reimburse here in 2017. They're just choosing not to reimburse themselves yet. They're going to wait until their first kid goes to college, pull those funds. Their eligible claims that they've already incurred, they can pull out those funds at any point. So they're going to do that when the first kid goes to college and pay for some of college with those health savings account funds. So it's a great way for you to manage when you're receiving those funds, how you're investing those funds, etc. It's really giving you that flexibility of deciding how and when you're going to reimburse yourself for those expenses. As I mentioned previously, Dassault Systems is making a contribution for you. So if you're enrolling in the health investment plan, if you're employee only, the company is making a $750 contribution. If you're signing up for family coverage, and that includes the employee plus spouse or employee plus children, the company is making a $1,500 contribution. Those contributions are included with your first payroll of the year. So again, you have access to those funds as soon as they're in your account. This is a bit different than a flex spending account in the sense that you're only able to reimburse yourself what's actually in your account. So if perhaps you're signing up for the plan and you decide to put away $5,400 into your account in 2018, the company is putting in $1,500. You're going to be putting in $5,400. The company contributions going in with that first payroll. Your contributions would be going in over the course of the full calendar year. So per pay period is going to be divided out in terms of how your contributions would be going in. So again, you can contribute any amount that you choose to, but in terms of reimbursing claims, etc., you'd only have access to what you'd actually contributed to your account at that time. So I know a lot of people, what they want to do is make sure they're contributing enough so that that deductible limit on the health savings or on the health investment plan is covered. Some are certainly maxing out those contributions, and that's certainly a great goal. But But if nothing else, as long as these people have that deductible period covered, they feel confident that once things are covered at a co-insurance rate only, or that 10%, they feel like from a financial perspective they can manage that. But making sure that the deductible portion is covered gives them that peace of mind. So again, the health savings account is a tool that can really make the health investment plan worth it for you. It's certainly a tax savings opportunity, and certainly another way for you to invest money to really grow whether it's your retirement portfolio or just your overall savings portfolio. So we talked from the morning session today. There were a number of questions about the health investment plan and specifically the health savings account. So we do plan to put together a presentation for you specifically on the medical plans in more detail, but probably with a heavier focus on the health investment plan and health savings account. So look for that either next week or the week after. So Catherine will send out an invitation on that. Moving on, unless anybody has questions, I don't want to I suppose hog all of your time if you do have questions on anything we've talked about so far. Okay. And I suppose just to make sure that we did have a bit of audio problem before, can somebody let me know that they can still hear me?
I can hear you.
Okay.
We can hear you.
I was getting nervous that I'd just been talking for 40 minutes and none of it was being recorded or seen. So perfect. Okay. So moving on to our dental plan. Dental plan is through Delta Dental, which is again the provider I think that you're familiar with. This is who you've had as well. Our plan is fairly similar in terms of plan design. I suppose the key things to note here is again our calendar year, the calendar year max on the DeSoto Systems plan is a bit higher at $2,000, as well as the orthodontia lifetime max of $2,000. So we do first and foremost strongly encourage you to take advantage of the preventive screenings going in semi-annually for your teeth cleaning. There's no cost to that. The other piece to taking advantage of that is as long as you go in for at least one screening per year, you're able to have the potential to have funds roll over to the next year. So you have the ability to have up to $600 roll over into 2019 as long as you get that screening and you have claims less than $800 in 2018. So instead of having a $2,600 calendar year max in 2019, you'd actually have $2,600, or instead of a $2,000 max, you'd have a $2,600 max in 2019. And you can continue to build that up until you've got a calendar year max of $3,500. So again, if everything's going well with your teeth, you get your semi-annual or you get at least one annual cleaning per year, you have that ability to really build up that calendar year max so that if and when you do have an issue, a more significant issue with your teeth, you've got a larger calendar year max to work with. And the other thing I do want to point out is, again, here are the rates for our dental plan. Again, these are biweekly, so keep that in mind in terms of if you're doing any sort of comparison with the CST plans and what you're used to paying. These are biweekly versus what you were paying on a monthly basis previously. The vision plan, I think, is new. I don't think you had access to a vision plan previously with CST, but we do offer a vision plan. In this case, I strongly recommend that employees take advantage of in-network providers with VSP. With this, you're getting an eye exam, again, at no cost to you. You get lenses for your glasses at $25. You get money for your frames. You get up to $150 towards the purchase of frames on an annual basis. If instead of glasses you wear contacts, we give you $150 towards the purchase of contact lenses on an annual basis. So there's a lot of great features. If you or anybody in your family wears glasses or contacts, the cost of this program versus the benefit that you'd receive is significant. So I strongly recommend that if this in any way applies to you. I do want to point out, too, and we didn't mention this before, you're able to sign up for each of these different benefits for whatever your specific family needs are. So if you are putting the whole family on the medical plan, but maybe you've got young children, maybe you've got a baby, a 1-year-old, and they don't need dental or vision plans yet, you can go ahead and sign up for family coverage on the medical plans, and employee plus spouse on the dental and vision. Whatever works for you and your family is what you can elect for each individual plan specifically. So keep that in mind in terms of when you're making these selections, you're choosing what's right for each specific plan. And then again, every open enrollment, you'd have an opportunity to make adjustments to that as needed. Disability benefits, these are benefits that are provided automatically to you. The next several are going to be automatically provided to you. We provide short-term disability and long-term disability to you at no cost to you. You're automatically enrolled in these. The short-term disability is paying you 100% of your base salary for the first 7 weeks you're out of work, and then it drops to 2/3 of your base salary for the remainder of those first 90 days. So that's that short-term disability, making sure that you've got some income coming in if anything were to happen to you in the short term. Long-term disability kicks in after you've been out of work for 90 days or more, starting on that 91st day. Long-term disability would be covering you if anything were to happen to you, and that's paying 2/3 of your on-target earnings. So I do want to point out short-term disability is looking at just your base salary, whereas the long-term disability is taking into account your base salary plus any type of variable component that you have. So if you get you have a bonus target or commissions, etc., those are factored into what your long-term disability benefit calculation would be. Similarly, we provide basic life and basic AD&D insurance for all of our employees, and those are both valued at 1.5 times your on-target earnings. So again, you don't need to elect these benefits. You're automatically going to be enrolled. The only thing that we do ask with the life insurance is to make sure that you choose your beneficiaries for life and AD&D. We've unfortunately had terrible stories of employees that had passed away and didn't have beneficiary information. It makes life difficult on their family members, etc. So please make sure you are choosing beneficiaries for your life and AD&D benefits. In addition to the basic coverage that DS is providing, you do have the opportunity to purchase additional life, and obviously they're at group discounted rates, so we do think the rates are quite competitive. You can purchase additional life insurance on yourself. You can get up to $500,000. You're going to be guaranteed approved for the first $250,000, which basically means if you sign up for $250,000, you're going to be automatically approved for that. Actually, if you sign up for $500,000, you're going to be automatically approved for the first $250,000. Anything above that $250,000 requires what's called evidence of insurability, or basically where you're going to provide some medical information to the insurance company, and then they decide whether or not they want to insure you for anything above that $250,000. So that's for the optional life. Optional AD&D, you're going to be automatically approved for any amount you choose up to $500,000. And then dependent life, for your spouse or domestic partner, you can get half of whatever it is that you signed up for yourself. So if you signed up for $250,000 on yourself, you can get up to $125,000 on your spouse or domestic partner. Your spouse or domestic partner would be automatically approved for the first $50,000. Anything above that would require that same evidence of insurability documentation. And then finally, there's child life. So again, you can get child life for any child that you have under the age of 26, and it's $10,000 coverage per child. Moving into the time off, Dassault Systems does provide time off. We certainly think that working at Dassault Systems is great, but the reality is being away from work is great as well, and certainly an opportunity for you to recharge your batteries, get away, and come back re-energized. So we do provide vacation, holidays, and sick time to all of our employees. In terms of vacation time, we are taking into account your CST time in terms of seniority, but during your first 5 years of employment, you get 15 days of vacation annually. Once you have been here for 5 years, you move it to 20 days of vacation annually. And once you've been with Dassault Systems for 15 years, or again, starting with your CST time, but to a maximum of 15 years of service, you would get 25 days of vacation. We provide 8 official holidays where all of the offices are closed, and then you also have 4 floating holidays that you can use at your discretion. So those can be used at any time, but they don't roll over, so keep that in mind. But those floating holidays, if there's a holiday that either DS is recognizing or you just want to take off your birthday, etc., that's what a floating holiday can be used for, or it can just be used just like vacation days. Sick time, 10 days of sick time you can use at your discretion. They are used if you are sick or if you have a sick family member. We have a fairly broad definition of usage for sick time. So it's obviously for you or yourself, or perhaps for a child, but it also goes if you need to take care of a parent or an aunt or an uncle, a a grandparent, etc. It really is designed to make sure that you have the ability to take time off and keep your family well, or to take care of family members when they're not well. So you do have quite a bit of time from a sick time perspective. Going back quickly, though, to the vacation, we do allow, I think it's similar to what CST has in place today as well, you can carry over up to 5 days of sick time. There are different from one year to the next, and so again, if you're thinking about perhaps saving some time so you can go on an extended vacation the following year, you can do that. Again, you can carry up to 5 days of sick time per year. Some states have different legislation that DS follows. So, for example, California, instead of a carryover, a limit on the carryover, in essence, what you can do is you can build up your account to a maximum of 1.75 times your annual accrual. Once you've reached that cap, you don't accrue anymore until you've used some time, but it does give you the flexibility to continue to not worry about carryover, but what you're really focusing on is making sure that you're using your time and not exceeding that 1.75 times your annual accrual. I think CST also has, I think, at least one employee in Colorado. Colorado has a similar rule, except theirs is 1 times annual accrual. So you can carry over up to 1 times, or your maximum account balance can be no more than 1 time your annual accrual. Once it reaches that, you stop accruing until you've used some time. Just in terms of the holidays, so that you're clear on what days would be off within Dassault systems, or that you'll have off as paid holidays in 2018. You can see the list here. I think they're fairly standard and should match somewhat similarly to what you had with CST as well. Then, as I mentioned before, the floor floating holidays you can use if there's a cultural or religious holiday that DS isn't recognizing. You can certainly use those floating holidays for that. Otherwise, you can use them just like vacation time. The key is that the floating holidays do not roll over from one year to the next. So typically what we recommend is using those floating holidays first when you're thinking about your floating holidays and your vacation time, because the vacation time does give you the flexibility of carrying over some of those days. So keep that in mind. And again, we strongly encourage you to take time so that you enjoy being here and you don't feel burned out. We also offer parental leave. Parental leave is designed to make sure that if you have a child, whether it's through birth or through adoption, you have time to bond with that child. So for birth parents, we do provide we provide 6 weeks off paid for that, and that is above and beyond disability benefits. So short-term disability typically pays a benefit, and then you would also have the opportunity for this parental leave as well. If you are the non-birth parent or the adoptive parent, you have the ability to, excuse me, you have the ability to take up to 2 weeks off for bonding. And again, these are paid time off. We encourage our employees to be excited about this change in your life and this new child in your life. So you do have that opportunity to take that time off as a paid benefit to experience that time at home, and you have that ability to take that time anytime within the first year of either that adoption or the birth of that child. Retirement savings, we're going to actually have a whole complete section specifically on the 401k plan, but I wanted to give you some highlights today. That session that'll go into much more detail on the 401k plan will take place in late November, early December. So that's when we're going to get more into the investment choices and how to sign up, etc. But just on a high level, the Dassault system does have a 401k plan. You can contribute up to $18,000, or we don't know the 2018 limits yet, but the 2017 limits currently are $18,000 if you're under the age of 50, or $24,000 if you're turning age 50 this year or older. With our plan, we actually have 2 choices of how you want to contribute to your plan. You can contribute, we'll say the more typical way, pre-tax, where you're having deductions taken out of your paycheck pre-tax now, and then when you retire and pull funds out, you'd pay taxes at that time. You also have the option of Roth or after-tax dollars taken out of your paycheck today, and then you don't pay any taxes when you retire. So you have the flexibility to do either or both. So you can split your money, have some coming out pre-tax and some coming out post-tax. today to sort of hedge your bets in terms of what tax bracket you'll fall into later in life when you want to actually use those funds. DS has a different matching formula for employer contributions than what CST has today. We match 50 cents on the dollar up to the first 8% of your contribution. So if you're contributing 8% of your pay, you're going to receive 4% in terms of company match. So that company match percentage is the same as CST, but how you get there is different. So it does require a bit more contribution on your behalf in order to reach that company the maximum company contribution. The other thing that is different is the vesting schedule. Today with CST, you have immediate vesting, whereas on the DS plan, you have to work for a period of time before you're fully vested in those company contributions. You can see on the chart below, once you've been with CST, and I should point out your CST time does count for service. So again, if you've already been with CST for 4 years, you're coming into the DISTO Systems plan 100% vested in company contribution. But if you've got, say, a year of service at this point with CST, you'd have 25% vested. You would be 25% vested in those company contributions. On your 2-year anniversary, 50%, 3 years, 75%. And once you've been with combined CST and DISTO Systems for 4 years, you'd have 100% vesting in any of those company contributions. Does anybody have any questions about that? So as
I got a question.
Oh no, go ahead.
Can you put a lump sum in early in the year?
Yes, in essence, you can contribute up to 75% of any paycheck into your 401k. So in terms of lump sum, that would be the limitation, is how much you can put in from any one paycheck. You can't make a contribution external to payroll, so it has to be a deduction from your paycheck. But in terms of how much you can contribute, you're going to have control throughout the year. So every paycheck, you have the ability to go into the Fidelity system, change your contribution amount, so that if you decide that whatever you want to front load or max out your contributions in 2018 in the first few paychecks of the year, as long as you earn enough, you can absolutely do that. So you can contribute whatever percentage of your pay that you want to. And I suppose just for your peace of mind, again, front loading your 401k isn't going to penalize you in terms of employer contribution. We only do match contributions based on what you contribute from a specific pay period. But at the end of the year, we do what's called a true up, where we look at what you've earned for the year, what you have contributed for the year, and then what the company has matched to that point. If there is additional company match that would be needed, that would be added in during that true up process. So it's designed in essence to not penalize anybody that does like to front load their contribution or perhaps backload their contribution. You've got that flexibility to get those full company match throughout the year.
Thank you.
I had a question about the vacation days.
Okay.
So for vacation days, I know 3DS does it based off of accrual, but CST does it based off of giving the days all at the beginning of the year. So how does that transition work?
Sure. Really, so if you are in the, say, 15 days time period, you have the full ability to use those 15 days anytime during the course of the year. That accrual rate is really designed for if you were to terminate during the course of the year, how much would you get paid out in terms of how much have you earned of that time during the course of the year. But you do have the flexibility to use that time, those 15 days, anytime during the course of the year. Same with the floating holidays. In essence, after January 1st, you can use those floating holidays at any time during the course of the year. You don't have to earn them in order to use them. It's really just more for an accounting standpoint.
Okay, I see. So, and then when it says employees in California can maintain a maximum vacation balance of up to 1.75 times annual accrual, does that mean we can roll over? So before you said 5 days,
right?
Roll over. So what does that mean for if we're in California? How many can we roll over?
So in essence, you will be able to continue to roll over any amount until you get to, so for a person in California, if you're in the 15 days of vacation, your max bank of time would be 26.25 days. That's 1.75 times the 15 days. So you'll continue to accrue, if you don't take any time, up to 26.25 days of vacation. Once you've reached that 26.25 days, you can't accrue any more time. Okay, so once and until you take some time. If you take some time and you work your balance down below that 26.25 days or 26 and a quarter days, once you've used some time, then you'll start accruing again until again you reach that cap of the 1.75 times your annual accrual.
So does that mean we can carry over? So does that mean
Yeah,
so
you can.
so
So if let's say you start off 2018 with no vacation carried over from previous years. So during 2018, you use no vacation time, you take no days off. At the end of the year, you've got 15 days. Those will continue if you're a California resident into 2019, and you'll continue to accrue in 2019 until you reach 26.25 days. Once you've reached that 26.25 days of accrual, your accrual will stop. You're capped at that 26.25 days until you take some time. If you take a day off that you've used 8 hours, you'll be able to start accruing again until, again, you sort of bounce back into that 26.25 day cap.
How many can we roll over this day, this year?
Well, so I've seen your balances, and I don't think anybody is anywhere near that 26 days of carryover. So you'll start off next year with whatever your current balance is going into 2018, and again you'll just continue to accrue until you hit that 26.25 days. If you're in that 15 days of vacation annually.
But we were told we could carry over 5, and I have more than 5.
And you're in California?
Yes.
Right. So again, for California people, you have a different state rule than other states. So there's 2 states at this point, California and Colorado, that have different rules. So if you are in California, you would be following the rules here of you can carry over your annual bank your bank of time, not thinking of it annually, won't get any larger than 1.75 times your annual accrual.
Right. So this is Maureen. If you end this year with more than 5 days and you're in California, all those days will be carried over to DS. You've already earned them; they need to be carried over. That's the state of California regulation.
I think I have 12, and that would make 27. So that sounds like one too many.
No. Because again, you're going to earn that time throughout the course of the year. Does that make sense? So on January 1st, you could certainly use whatever the 12 days that you've carried over, and you can use all 15 days, but you're going to technically be earning those 15 days throughout the year. So even on January 1st, you have the ability to use 27 days, but you wouldn't be able to, and your bank wouldn't show that you had 27 days yet. On January 1st, you'd have 12 days plus whatever that first pay period, you're going to get 4.62 hours added to your account. So it would be 12 and a half days, basically, with that first payroll of January. Does that make sense?
Yeah.
Okay.
Thank you.
Going back to the 401k plan, I did want to point out that Dassault Systems works with a financial advisor through Arthur J. Gallagher, and they're designed to do 2 things. One is work with the company itself to help us figure out what are the right investment choices to make available to our employees. There's a steering committee that meets on a quarterly basis, and they're designed really to make sure that the plan is running well and that we are offering choices that make sense for our employees. But in addition, Arthur J. Gallagher also works with you, the employees, at no cost to help you really certainly understand the 401k plan itself, help you understand the investment choices, and help you figure out what are your retirement goals and how do you get there. So you have the ability at any time, at no cost to you, to have a meeting, and you can have as many meetings as you'd want to with our representatives at Arthur J. Gallagher, Kendall Storch, and Adam Maloro. You can contact them at any time to have a meeting to talk about your retirement. So please take advantage of that. Like I mentioned before, the end of November, early December, Kendall from Arthur J. Gallagher will be doing a presentation in much more depth about the 401k plan, not only the Dassault Systems plan, but really talking about that transition because the CST plan is what's called a plan-to-plan merge or transfer, and so those funds, your existing funds in the CST plan, will move over into the Dassault Systems 401k plan sometime in 20.
I had a question about that rollover part. So if we rather roll into IRA, is that possible?
No, unfortunately, again, the 401k plan, the CST 401k plan, it's not terminating. So what it's doing is the active plan is moving into the Dassault Systems plan. So you don't have the ability to withdraw those funds and do something else with it. It's going to stay a 401k plan, and it will roll over into the Dassault Systems plan automatically. You won't have to do anything for that to happen. It's going to happen automatically for all participants within the CST plan. It's just moving it from its current place into the Dassault Systems plan, and it'll maintain its same vesting schedule, like you're aware of. The CST plan had immediate vesting, so all the funds that are sitting in that CST plan, when it rolls over to the Dassault Systems plan, it'll maintain that same 100% vesting on all of those funds from the CST bank. So it'll be in a separate bucket, in essence, within the Dassault Systems plan, guaranteeing that remains 100% vested.
Oh, but does that mean, so what if we don't open a Dassault 401k plan? Then what would happen to our funds?
Same, and no matter what, an account will be opened in the Dassault Systems account in your name. Obviously, every CST participant will have an account, in essence, set up that'll have your name and address, etc. And again, if there's an existing balance coming over from CST, it would go into that Fidelity account. Technically, the same thing will happen to any terminated CST employee that has funds still in the CST plan. Their account would then come and sit within the Dassault Systems account within Fidelity.
But then, when we get, I heard we will get new contracts in like 2019. When that happens, will we be able to roll over our 401k into IRA?
I'm not sure what you mean by new contracts, but no. I mean, the reality is this will be, the funds are moving from CST 401k into the Dassault. The whole plan is merging into the Dassault Systems plan. So you don't have the ability to withdraw funds from the account. For the CST funds would just be part of the DS plan.
Okay.
So just again, as of January 1st, instead of contributions going into the CST plan, you're actually going to be enrolling in the Fidelity account. You'll be, if you want to, but if you aren't making elections, then as of January 1st and onward, you won't have any contributions going into a 401k plan, whether it's the CST or the Dassault Systems plan. The CST plan will, in essence, no contributions will ever go into it after December 31st. But from January 1st onward, until you make an election within the Fidelity system, there wouldn't be any contributions going into the DS 401k plan either. So we have that presentation scheduled for late November, early December to really help you understand the investment choices, how to enroll in the Fidelity system, etc. If you do have a loan through the CST plan, that'll transition as well over to the Dassault Systems plan during that plan merge, which will take place sometime in early 2018. And then, like I said, you'll have access to certainly to still view your account in with your existing provider until those funds transfer over. I'll move on. There's just a few more slides in terms of our benefits and the enrollment, and then we can get through any questions that you may have as well. Dassault Systems does offer a legal services program, so if it's basically having an attorney on retainer. You can pay $9 per pay period, and you have access to an attorney to help you with any number of legal needs that you may have. I think probably the most common are, say you're buying a house or closing on a house, maybe refinancing a house. You can use the attorneys for that. I know a number of employees have used it because they wanted to make sure they had a will created. I'll give the example of a traffic ticket. I myself got a speeding ticket not anywhere near my house, and it did require that I needed to go to court for it. I was able to have the attorney represent me in this other state for that traffic ticket. I didn't pay anything other than the court fees. Obviously I was paying my $9 per pay period, but my point is if you If you think that you may have any legal needs, this is a great benefit to have. You're paying that $9 per pay period. That is undoubtedly less expensive than going to an attorney on your own and purchasing their services for a specific need. That $9 per pay period is really a good value if you think that you may have any type of legal needs in the coming calendar year. If you do enroll in the program, you are in it for the full year, so you don't have the ability to jump in and out of the plan as you wish. You're in essence signing up for that year and that $9 per pay period deduction from your paycheck. We also offer an identity theft protection benefit. It's certainly a hot topic in the news these days. InfoArmor provides an opportunity for identity theft protection. You get an opportunity to view your Tri-Bureau credit score on an annual basis at no cost to you. They're going to be monitoring not only your credit but your social media reputation, and there's an insurance policy in essence tied to that in terms of that identity theft protection. So you can purchase this coverage if you want. Again, it's totally voluntary. You can purchase it to cover just yourself, or if you wanted to cover other family members as well, you do have that flexibility to do so. The Wellness Program is a program that's newer to Dassault Systems. We started this program back in 2016, and really this goes back to the heart of what we were talking about in the beginning about the overall wellness of our employees. The program through Vitality is designed really to encourage and reward healthier behaviors by you or by you, so that you are both healthier and you're encouraging your family members as well to be healthy. The wellness program is focused really specifically on you. It's rewarding you for any type of physical activities that you're doing, but also for education sessions that you're taking, like they have nutrition courses or different learning opportunities or action sets that are available. There are rewards for, or you're being rewarded for doing some of those preventive screenings, so getting a flu shot or getting a mammogram, etc. Those are things that are going to provide you points. Those points turn into bucks, and the bucks can be used for any number of things that they have in their mall, their shopping opportunity that you're using these earned points for. So if you're getting fitness equipment or you're getting gift cards, so the gift cards, those include things like Amazon or I think Nike, etc. Or if you need to get, or if you'd like to get some sort of fitness tracking device like a Fitbit or a Garmin or a Polar, etc., you can use your points to do that as well. They have all those types of devices available to you. So really, again, this program is designed to encourage you to be and to live a healthier life. And so we do encourage all of our employees to participate. We are not anywhere near, say, 100% participation yet, but the population as a whole within Dassault Systems is getting more and more used to it, and we've grown to over 50% of our employees are taking advantage of it. We're finding more and more people that are enjoying the program and giving us feedback about what they'd like to see more and more of. So, for example, just a few weeks ago, we wrapped up an all-employee challenge. It was a fitness physical activity challenge. So employees were across the country within Dassault Systems were competing against each other in terms of trying to earn which group earned the most points or who did the most days of physical activity over a 4-week period of time. So not only is it wellness initiative or wellness based, but it's also an opportunity for some competitive camaraderie amongst you and your employees. So those types of activities take part throughout the course of the year, and come January 1st, we encourage you to join up and participate in that program as well. We do offer an employee assistance program, so if you or any of your family members have any type of personal or professional issues that you're dealing with, you can certainly reach out to the employee assistance program at any time. They're available 24 hours a day, 7 days a week to help you. They also, I think a lot of people think of it specifically, say, for mental health, but the EAP can really assist you with any number of issues, and you can see the list of things below. So whether you got some legal concerns or financial issues, perhaps you're, I know one thing that employees use it for is summer vacations. Perhaps you've got a child that you're trying to find good summer camps for them to participate in. The EAP program through KGA, they've got a great website that helps you find camps in your your area that if you're looking for a soccer camp or an outdoor adventure camp, etc., they've got all of that that they can help you find what's available in your area so that you can take advantage of that. So the AAP program does webinars throughout the year. We also have some that are hosted specifically at Dassault Systems for Dassault Systems employees, so please take advantage of any of their services. The medical consultation services through Best Doctors is an interesting program that we think provides a lot of value to our employees. Certainly, if you ever have the specific need, we have found that those employees have really valued it. And I suppose in terms of to tell you about it, the Best Doctors program is really designed or is built upon doctors recommending or referring, basically filling out a survey of if they had this medical condition or that medical condition, who would they want to go see? So these are, in essence, the best of the best doctors, or who doctors think of as best in their class within the medical field. That's who's within this Best Doctors program. And what the Best Doctors program gives you access to is, one, first and foremost, and probably the easiest, is finding a best doctor. So if you're looking for a new primary care physician, or perhaps you've been diagnosed with something and you want to see a specialist, you can find a best doctor within their network. Again, they'll provide you that information based on the fact that we have Blue Cross. They can identify who in the Blue Cross program is quote unquote a best doctor. So you can have access to that information. Ask the expert. There's always times when you've gone to the doctor's office, you didn't ask all the questions you may have, or perhaps you've been doing some research online about a disease or illness that you or a family member has and you just have additional questions. You can reach out to Best Doctors and they can help give you answers to any of the questions you may have. But really the reason why we have this program in place is the last one, the end of medical review. If you or a family member has been diagnosed with a serious illness or condition, you can reach out to Best Doctors and they'll look at any of the lab work, blood tests, etc., to first and foremost confirm that you've been diagnosed correctly, and then secondly, really help you to understand what all of your treatment options are, and make sure that you, your treating physician, and Best Doctors are on the same page in terms of what are the best options for you, and that you then can make the best decisions for you and your family. So the Best Doctors program is available to all of our employees at no cost. We strongly recommend that you take advantage of it if the need ever arises, and just know that it's always there if you do have a need. Commuter benefit, I don't know if anybody on the phone does take public transportation to and from work, but if you do, reach out to us. We can certainly help you get signed up for this. This is basically like a flex spending account where you're putting money away pre-tax to pay for any type of public transportation that you're taking. It is a great way to save money on taxes, and we'd be happy to help you get signed up for that if you have an interest.
What does parking mean?
So
that means you pay parking garage?
I think typically it's like if you're parking at a train station or parking at the bus stop. Sometimes you have to pay for those parking. It would be associated with that public transportation parking. No, it would not be like if there's a parking lot at your office and you have to pay $10 for parking. That would not qualify.
Okay.
Employee discount programs. We have a number of programs in place that's all tied under this PerkSpot program. PerkSpot is just an employer-provided discount shopping opportunity. So if either you or a family member likes to shop online, you can point them to that PerkSpot site. Once you're in the program, there are a number of different discounts. I know plenty of people that through the discount program have gotten great deals on, certainly on movie tickets. I think that's like the number one thing I ever hear about people is you can get bundles of movie tickets that you can get at a discounted rate. But also people have found great vacation packages. They've purchased they've gotten the discounted rates for purchasing a car or cell phones, etc. The PerkSpot site has not only all the discounts that PerkSpot makes available, but also we have a DS Exclusives tab in that section that includes the DS discounts. So a number of our partners or vendors have made available discounts that you have access to. So again, I know those, for example, those are a number of car manufacturers. You can get discounts on the purchase of their cars, cell phones, and computers. I've seen employees, I actually have taken advantage of some of these myself. So you can take advantage of the discounts for anybody that likes to shop online. This is a great place to do that. We also have the Liberty Mutual Auto and Home Insurance. Again, Liberty Mutual is the same company that does our life and disability benefits. They also do auto and home insurance, and they can provide typically about a 5 to 10% discount off of an individual rate through Liberty Mutual. So again, if you don't have Liberty Mutual, they can provide discounts. They could provide group rate discounts for you for that. And then Blue Cross, they provide a number of discounts, which again, you may already have access to through CST, but you can take advantage of as well through the Blue Cross Blue 365 program. Learning opportunities, we do strongly encourage employees to continue to further your education. Within Dassault Systems, we have the 3D Experience University, really designed to provide internal trainings and seminars. But there are times when we internally don't offer everything that you may need. So from time to time, you may need or want to take an external seminar or conference, and you have the ability to do that. Similarly, if you're wanting to further your education through a degree program, you can take advantage of that as well, and we do reimburse up to $5,250 a year for that. So please take advantage of the different learning opportunities within Dassault Systems. In terms of getting yourself ready for open enrollment, the rewards at 3ds.com site is really a one-stop shop to learn anything and everything you'd want to know about our benefits. We'll be rolling out an open enrollment portion of our website, really right here where you're seeing the welcome to 3ds rewards. It's a tile that'll slide. There'll be, I think, 3 different options listed out there, but one of them will be the open enrollment site. And that's where you can find any information you'd want about our benefit. Also, it's a great place. This is the place where you can go to click a simple click to find in-network providers, whether that's for Blue Cross or Delta Dental or VSP, etc. Any form or document you'd ever need is out here. And really, every plan description that you'd want to know more about any of these benefits, it's out here on the rewards at 3ds.com site. Once you're ready to enroll, again, the enrollment period is October 30th through November 10th. You'll go to the ADP portal to make your benefit elections. You can do that online. It's a quick and simple wizard enrollment, so it'll take you probably about 10 or 15 minutes to make your benefit elections for 2018. If you choose not to, you'd prefer not to do it over on your computer, you can also call our DS Benefit Center and they can walk you through that enrollment right over the phone. They're available, I think it's typically from 8 a.m. to 8 p.m. Eastern Time, Monday through Friday, so you have access to that as well. We can't stress enough adding the beneficiaries. I mentioned before that we've had examples of employees that had passed away and didn't have beneficiary information. It really makes things hard on your loved ones. So there are a number of benefits that will have a beneficiary associated with it. So when you're going through your enrollment with ADP, please make sure you're putting in the beneficiaries for your life and AD&D coverage. If you are signing up for the health investment plan, you'll have that health savings account. When you're accessing that account, you can online through Health Equity. There's a place to put in your beneficiary information there as well as when you're setting up your 401k plan in the Fidelity system. In terms of, or I suppose switching gears on just a few other items, we've talked throughout that payroll will be moving, it's still CST, but it's going to be managed by the Dassault Systems payroll team, and that means that it will be also switching from the monthly payroll to a bi-weekly payroll. That payroll is managed or is processed through ADP. It's switching to 26 pay periods per year versus the 12 that you have today. Your last paycheck through CST is that December 31st paycheck, and your first paycheck with Dassault, or that's being processed by Dassault Systems, is January 4th. That first paycheck you're going to receive is a 1-week paycheck. January 1st through January 5th is that pay period, and then every pay period after that would be a standard 2-week pay period. You don't necessarily have to fill out any forms in terms of tax forms, etc. Due to this transition, but we do strongly encourage you to pay attention to you have any sort of auto bill payments, or you have a direct deposit that's set up to have a certain amount of money going into an account every pay period, or you have your tax withholding set up to have a fixed amount coming out of every paycheck that you had on the CST monthly payroll that may not really apply to the biweekly pay schedule, or that you may need to adjust for the biweekly pay schedule. If you do have any of those needs, certainly let us know, and we can make sure that you can get those adjusted before that first payroll of the year. In terms of knowledge or learning more about both the payroll process as well as the time tracking process, information about payroll is going to be provided late December, early January. It's just some information about how you can log in to see your pay statement, and you'll be able to see your pay statements online from January 1st onward, or really January 4th onward after that first payroll. And then, like I said, the time tracking, we do have a time tracking system. I think if you are an exempt employee, you're not entering time every week or every pay period. You're entering only the time when you're taking sick days or vacation days, etc. If you are a non-exempt employee, you are tracking your time worked, and again, there'll probably be more in-depth training for anybody that's non-exempt in terms of how to enter your time into that system. So just be on the lookout for that, and we'll certainly have more information coming to you, and I'm sure Catherine will be in contact about that over the coming, or closer to the end of the calendar year. We also have a policy review and acknowledgement. So again, we'll get through open enrollment first. That goes through, like I said, November 10th. But then the week of November 13th, you're going to receive an employee letter, just again reiterating that change in the payroll frequency from the monthly to the biweekly. So helping you understand what that biweekly amount would be, as well as there are a number of other compliance documents that DS has employees review and sign. And so you'll have until December 8th to review and sign those documents, and we're working right now on how to make that a simpler process, perhaps through like a DocuSign action as well. So more information will come on that. We'll also make sure that you have access to the Dassault Systems Employee Handbook, so you can review that and understand all of the policies that will apply to you. And we know that there are some like expense reporting and time tracking, expense reporting and travel, etc., that don't necessarily apply right now or as of January 1st, but overall that employee handbook gives you information about that Dassault Systems experience. Just giving a quick timeline of what's coming. Again, we've covered an awful lot here today. We want to make sure that you do understand what's happening and what you need to pay attention to. Starting next week, you'll have access to you already have access to the rewards at 3ds.com site. We'll have open enrollment information available out there for you early next week. We do have a benefits fair at the Waltham campus. I don't know if anybody on the phone is working out of the Framingham office, but if you are, you can certainly attend that benefits fair in Waltham, and we encourage you to do so. It's always, I suppose, fun and informational, and most of the vendors bring stuff that some whatever tchotchkes and giveaways that you may be interested in. The benefits enrollment site itself and call center will be available to you beginning October 30th. So again, that's when you're going to be making those benefit elections, and we strongly encourage you to do so earlier in the process rather than later. And again, from now, actually at any time, you can reach out to me or anybody on the benefits team, and we can help you figure out the benefits or any questions you may have. You've got the enrollment period, October 30th to November 10th. We talked just right now about the various forms and documents that will need to be signed by December 8th. The 401k presentation coming up in early December. That's an opportunity for us to dive deeper into the 401k plan and really help you understand the investment choices that are available, how those compare to what you've had currently available within the CST plan, etc. By January 1, we expect you to receive your ID cards from the providers. So that would be your Blue Cross ID card, the Express Scripts ID card, and the Delta Dental ID card. Those would be mailed out to you. You'd have those in hand. So if any needs arose for January 1st, you'd have access to that information. And then, like I said, that first payroll of the year gets paid out on January 4th. So every other Thursday, starting on January 4th, you'll receive a paycheck from well, it'll still be through CST, but on that biweekly schedule, the same as others within Dassault Systems in the U.S. If you have questions, I know we've covered a tremendous amount today. we'll have this slide deck made available to you. We'll also have the recording of this presentation or the presentation from this morning available to you as well. I think Catherine's going to email that out either later today or Monday, and you'll have access to that information. You can reach out to any of us on the benefits team. Again, Maureen is on the call today. She is my manager for compensation and benefits. Linda Fifield focuses primarily on leaves of absence. So if you do know that you've got a leave of absence or any type of disability leave that you're concerned about or want to talk about, Linda would be the right contact for that. And then Carly and I suppose, manage a bit more of the day-to-day benefits and certainly can help you with any questions that you may have. So please take advantage of that. We hope that giving you this information now gives you the time between now and the beginning of open enrollment to get any questions you may have answered so that come October 30th, you're ready and prepared to go through open enrollment, to make those elections online, and feel comfortable about your decisions. Does anybody have any questions?
So for the gym membership, the $150 reimbursement, does that come from Blue Cross Blue Shield or does that come from 3DS?
It's Blue Cross. Yes, so you do have to be enrolled in one of the medical plans within DSO systems in order for that fitness reimbursement as well as that weight loss reimbursement program. They're both managed through Blue Cross.
Okay, thank you.
Any other questions?
Hi, yeah, I had a question. It was for the plans. So is there any difference in the plans in terms of health insurance coverage? For example, some tests that may be covered with one plan may not be covered with other, or?
No. Everything that is covered on one plan is covered on all three plans, meaning you're not choosing a plan based on that services are available on one and not the others. Everything that is covered on one is covered on all. That's a key point to keep in mind. It's really about how do you want to pay for your services. If you're on the copay plan, you're in essence saying, I want to just pay up front out of my paychecks, and then at time of service, I'm going to have a lower cost. The other two plans are really, I'm going to pay less out of my paycheck, but at time of service, I may have a higher expense. So if I have a need, I will pay a bit more on the co-insurance or the health investment plan potentially.
Okay, thank you.
I also have a quick question. Sounds like for the medical insurance, that each plan year is from January to December. Correct. Instead of from February to January, right?
That is correct. Right. So you will all be switching to a January 1st in essence a calendar year based annual basis. So okay. You were used to a February to January, and you will be moving right. January to January through December.
Okay, thanks.
Anything else? Well, certainly thank you for your time today. If you do have questions after today, please feel free to reach out to me at any time. I am happy to go over any of this in more detail. As I mentioned before, I think that there will be an additional presentation really focusing a bit more, I think, on the health investment plan next week. So if that's of any interest to you, please plan to attend. We know that plan is probably the most different from what you're used to within the CST world. So that's going to be coming up. And then again, the 401k presentation in late November, early December as well. So really trying to help you have the information that you need to make informed decisions for that open enrollment timeframe, and then certainly for the 401k plan as well, getting ready for 2018. But thank you for your time. And
how can we obtain this presentation?
Sure. Catherine is going to be, Catherine Gadarian will send out both the presentation and a recording. Like I said, it may be either this recording or from the session this morning will be emailed out to all employees.
Perfect. Thank you.
Okay. All right. Well, thank you for your time, and undoubtedly we'll talk soon. Thank you for your time today.
Thank you.
All right.
Thank
Bye-bye.
you.
Thank you.
Thank you. Bye.